Mealtime is more than a bowl of food. It's the foundation for a long and healthy life. At Wellness, dry recipes are crafted with the highest quality natural ingredients for a taste that pets love, and scientifically proven through AFCO feeding trials to ensure that every complete and balanced meal supports the 5 signs of well-being. With Wellness Pet Foods, pet parents can share a life of well-being together with their pet.
This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about how the implementation of a standard perioperative protocol reduces postoperative respiratory distress events in dogs undergoing surgical correction of brachycephalic obstructive airway syndrome with our guests Vanna Dickerson and Mason Hill.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Thank you so much for taking the time to be with us here today.
Yeah, thank you for having us.
Yes, thank you.
All right, let's dive right in. So Vanna, your JAVMA article discusses how the implementation of a standard perioperative protocol reduces postoperative respiratory distress events in dogs undergoing surgical correction of brachycephalic obstructive airway syndrome. Please share with our listeners the background on this article.
Yeah, so I think, as veterinarians, we're all very well aware of how popular these brachycephalic breeds are becoming. I've been in the veterinary field since early 2000s, and even I can just massively see how much more frequently we're seeing them. And I think especially as surgeons, maybe we see even more of them to address their airways. And along with that, we know how scary kind of the complications in the perioperative period can be. So, we, shortly after I arrived at Texas A&M, had a group meeting between our surgery, anesthesia, and critical care teams where we all sat down, kind of reviewed available literature, and that's sort of where the protocol that we evaluated in this study was born.
Yeah, like you said, I think they're definitely very popular as pets. And we chatted about this before we started the podcast, but your article is super popular on social media, reaching over 77,000 different people, which is incredible. So a very important topic. I remember talking to some UGA surgeons too, and they were talking about like the bulldog special for their brachycephalic surgeries there. So definitely something worth investigating.
Yeah, for sure.
So Vanna, what are the important take-home messages from this JAVMA article?
Yeah, so I think, we made a lot of changes in how we manage these patients pre and post-operatively in our study. And, of course, because we made so many changes all at once, it is one of the limitations, right? We don't know what actually made the most difference. But I think for me, I think the biggest takeaway is just this is another study sort of pointing to you really do need to treat these dogs a little bit differently than maybe our dolichocephalic counterparts in the perioperative period. And that's true, I think, whether or not we're performing airway surgery. So I think it's just another kind of piece of the puzzle to me that shows we really kind of have to think differently with these guys.
Yeah, before they're, what did you call it? Surgeons in popularity or something like that. It used to be the Dobermans we were worried about. And nobody really talks about Dobermans anymore in their surgical risk. It's all relative, I guess.
Yeah.
Mesa, what sparked your interest in brachycephalic obstructive airway syndrome?
Yeah, so similar to what Vanna said, especially when I was at A&M and still true here up at Ohio State, brachycephalic dogs constitute a large proportion of the dogs that we see on soft tissue surgery for airway surgery, but also we see them throughout the hospital on our orthopedic service for musculoskeletal abnormalities and our neurology service related to intervertebral disc disease. The scope of this paper was very much focusing on their perioperative outcomes related to upper airway surgery. But certainly posed the question of should we be considering implementing protocols similar to this, whenever they come into the hospital, because we can see them have these respiratory distress events, regurgitation, aspiration, whether they're with us or with other services. So that was kind of our starting place. And the next thing, as Vanna alluded to as well, was that the complications that these patients do experience when they're here seem to be more frequent, but also more severe. And they can be both financially and emotionally devastating for families. And so researchers at Tufts University originally a few years back implemented a protocol similar to the one that we implemented that really sparked an interest in the team at Texas A&M because they were able to reduce regurgitation events in their patient population. And so specialists across multiple disciplinaries came together and made this protocol. And I, as a student and then as an intern, was in a unique position to help evaluate its impact on our patients.
Fantastic. Vanna talked a little bit earlier about some of the take-home messages, and yet many, many things were investigated at the same time. So for you, what were some of the very surprising things from this research article that you found?
Yeah, I don't know if it'll necessarily be surprising, but I think a major point of interest for us was that in our post-protocol groups, so the group of patients, dogs that were enrolled after protocol implementation, and when we evaluated their historical findings, they had an increased incidence of regurgitation compared to those dogs enrolled prior to protocol implementation. When we were evaluating our results, we ultimately did not find a significant difference in the outcomes of regurgitation and aspiration in this post-protocol group. And so the question became then, well, was it related to the protocol, or was it more related to the fact that these patients historically regurgitated more? And again, kind of makes the point that's kind of straightforward that, well, regurgitation pre-op may beget regurgitation in the periop and postoperative period for these patients. Multiple studies have identified this as a problem, though to my knowledge, at least at this point, this hasn't been evaluated prospectively. But I think it certainly makes us have to wonder, not only do we need to be treating our brachycephalic patients, especially because we know that they're in increased risk, but this specific group of brachycephalics that has historic regurgitation, I think is going to need additional evaluation and care moving forward.
Off a completely beaten path, do either one of you think that the popularity in these breeds will go down now that a giant schnauzer finally won the Best in Show at Westminster?
Maybe. I don't know. I feel like they're, especially the Frenchies. I mean, they're stinking cute, man, and they're the perfect size to be in lots of different households. So I don't know.
Yeah, very true. How about you, Mason? What do you predict?
Yeah, I agree with Vanna. I'm not entirely sure. I just hope, when folks invest in these dogs because they are precious and they are perfect family members, that, they're just aware that they can come with some increased chance and risk for complications related to their airway and otherwise. So I think us, as a veterinary profession, just doing our best to educate our clientele and let them know what can occur is really, really important moving forward.
I like what you said, and otherwise. It's not just anesthetic complications, it's and otherwise.
Yeah, funny enough, the soft tissue surgeon from my rotating internship owned a Frenchie. I remember learning that and I was like, huh, the more you know. So did not expect that. So Mason, you did talk about some areas of future research, such as looking at like regurgitation events, but is there any other areas for next steps for research in this topic?
Yeah, I know. I really did allude to my kind of next point here, which is that I think us really evaluating this population of brachycephalic patients that have historical regurgitation and how we can impact that moving forward. Looking at prospective studies, really wanting to evaluate for me how the use of prokinetics, maybe receiving them more long-term prior to hospitalization and PPIs would be really beneficial. Just because in a lot of our patients, they're prokinetic administration and kind of medical management strategy was initiated very close to time of hospitalization. And so I just wonder if we prolong that, could we potentially benefit them? But I think there is a breadth of research that remains to be done looking at these patients as a whole.
Well, we look forward to hopefully seeing a manuscript about that in the future. So AI is definitely a really hot topic, and we actually have a AI supplemental issue coming out in AJVR in March about AI in veterinary medicine. So Mason, do you see a role for AI in this area of research?
Yeah, I think, important for me to mention is that I have not yet myself delved super far into the utility of AI, but I'm really excited that we're really embracing it as a field and think that it will be very impactful for us. Areas where I think it could be beneficial, especially on the conversation of looking at these patient population of brachycephalics that have historic regurgitation, is doing like a multi-institute study evaluating these patients and using AI to help assimilate that information and help develop the protocol that could impact these patients. That's kind of my general thought. And I didn't know if you had anything you wanted to add to that.
Yeah, I mean, I did. I think this is a really interesting question. I do wonder, one of my colleagues here just recently published, I think in veterinary surgery, a paper where they're trying to look at, could we remotely grade how severe brachycephalic airways are? In the UK, there's a bigger push to maybe work a little bit harder to sort of breed for better, kind of more health sustaining traits in these dogs. And I mean, I wonder if we ever get to a point, could we train AI to listen to how severe Sturder is and maybe combine it with things like the brisk score that's been published to help us quickly identify which patients are more at risk.
Yeah, it's a super cool question. We're actually going to be going back and looking at all of the answers and combining everything for some future research topics. So it's pretty cool. And for those of you just joining us, we're discussing how the implementation of a standard perioperative protocol reduces postoperative respiratory distress events in dogs undergoing surgical correction of brachycephalic obstructive airway syndrome with our guests, Vanna and Mason.
Vanna, you described how you designed this protocol with a multi-team approach, and then you had to implement it and do the research and write the manuscript and get it across the finish line. How did your previous training prepare you to get all that done? It's hard to get from the concept to get everybody on board and really finish it. I think that would be really interesting to hear what you have, the advice you have to give to other authors.
Yeah, I mean, I was fortunate, Mason is one of those vet students, as many of them are, that are just incredibly eager to help with things like this. So a big help was having her be so excited about the topic and really taking it head on. But, Sarah, you mentioned UGA earlier. I was there for actually 10 years through vet school. And then I did do a research fellowship and my residency there. So I think for this topic specifically, had a ton of exposure to what we called the bulldog special there, but just brachycephalic, dogs in general. And we did during my residency also publish an article looking at a different way of doing their rhinoplasties, which it's interesting to me. I don't even do them that way anymore, and I think it just speaks to how quickly this field is changing. But in terms of getting this published and through the finish line, we're fortunate here, I think, to have a collaborative enough environment for everyone to be very excited about trying something new and seeing if it can help our patients. So I think that was kind of step one here, is just getting everyone excited about it, getting everyone on board. And then since we looked at it retrospectively, then a lot of the work really was on dear sweet Mason, who made a very large spreadsheet and helped us to get through it. And we did make sure to have, authors from all different kind of specialties on this article as well, just to make sure we were kind of encompassing everyone's thoughts.
I think it's really cool how collaborative everyone's being on this topic. My husband and I were watching the Illinois basketball game the other weekend, and they actually had a commercial for the vet school, but the focus was on Heidi Phillips and her brachycephalic research as far as soft tissue surgery goes. So I was like, that's so cool. They're using that airtime to promote that. So
Yeah. We and even at the surgery conference just a couple years ago, we had kind of a little special group that talked just about these brachycephalic dogs and kind of what could we be doing in research in the future. So
this next set of questions is going to be very important for our listeners. Vanna, what is one piece of information the veterinarian should know about the surgical correction of brachycephalic obstructive airway syndrome?
Yeah, I mean, so I tell my veterinary students all the time that the surgery is not the hard part of managing these dogs, especially if you're speaking, specifically about airway surgery. It really is that perioperative crap that can go wrong and making sure that you can handle it. So, I mean, I really think it's important for every practice, if you're going to be seeing these patients, and certainly if you're going to be anesthetizing them, to try to figure out what's going to work for you. We did put our here when we instituted this protocol, Dr. Ida, one of the anesthesiologists on it, helped make a really pretty kind of one pager that we could just put up in the hospital, make it really easy for everybody to see and use as sort of a checklist. So, and that's available as a supplementary material on the article. So I think people maybe reference that, but kind of try to develop what protocol is going to make the most sense for you with what drugs you have in your practice, how much monitoring you have, and maybe these higher risk dogs that do already have a history of a lot of regurg and things like that, even though the surgery's not that bad, maybe those are dogs you refer just because of the potential need for really heavy aftercare.
Now, on the other side of the relationship, what's one thing that clients should know about this topic?
Yeah. So, even though we talk about a lot of scary things that can happen with these surgeries, I do still think that in most cases, the benefits of pursuing kind of getting their airway addressed still outweigh the risk of not doing anything about it. So I think that's important to understand. And along those lines, I do think clients should feel empowered to talk to their veterinarian about, hey, how much experience do you have anesthetizing these dogs? What is the plan if something goes wrong? Are we 5 hours away from the nearest emergency clinic? Or, do you have someone overnight that can help watch my pet as they recover? But I do still think, even though there are scary things that can happen, it is uncommon. Mortality rates actually both pre and post protocol in our study were less than 10%. So they usually still make it through it. It just sometimes is a little bit of a rocky road.
Exceptionally well summarized. As you wind down, we like to ask a little more of a fun question. So Mason, for you, what is the oldest or the most interesting item on your desk or in your desk drawer?
We have a very large 1980s Rolodex on our desk at home to keep contact information for friends and such. I have no idea where it came from, but it is a unique staple to the house now. So
Very cool. Because everything's in my phone, and if I lose that, I'm in big trouble.
right, it's an old school backup.
Vanna, this one usually dates people, but what was the first concert you attended?
Yeah. So the first one that I can remember being kind of big that I went to was Weezer, actually, and it was so much fun. And actually, this question made me think about how I need to start going to more concerts
Where did you go see them?
in Atlanta.
Okay.
Yep.
Wow. Do you want to answer that too, Mason? You look a lot younger than the rest. Well, maybe not Sarah, but
I grew up listening to a lot of like red dirt Texas country. Probably no like big names, but they're fantastic. So if that's something that interests y'all, I implore you to dig in. But
very cool.
good times.
Yeah, it's a fun question. We haven't asked that one in a while, so I was happy to bring that one back. Thank you, Vanna and Mason. Really appreciate you spending your time with us today and also for contributing your research to JAPMA.
Yeah. Thanks again for having us.
Yeah, thank y'all so much.
And to our listeners, you can read Vanna and Mason's article in JAPMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.